Officially, the fourth wave of COVID-19 began a predictable 2 weeks following the intensification of the campaigns for the general elections. Followers of the two major political parties attended meetings, motorcades and other mass crowd events as each party sought to drum up support for its side. The warnings were sounded, but the messages were drowned by the campaign rhetoric and songs. All along, the lively political events and private parties provided a near-perfect fertile ground for the spread of the virus. The campaigns were in many ways a compensation for the carnivals that never were. Supporters, cladded in party colors in celebratory mode, let down their guards. By the 25th of July, ahead of the July 26 polling day, the numbers had climbed up steadily. Within days, it was official. A fourth wave of COVID-19 was declared. From then, it was a steady flow of depressing data as the number of positive cases and deaths skyrocketed. By August, the numbers were alarming, consecutive days of hundreds of cases recorded. It was all too much for the already stretched healthcare sector to handle. Despite the spike in positive cases, resistance to the vaccine remained resolute as those skeptical of inoculation received a steady stream of carefully crafted messages on social media, with doubters also flooding the local talk show circuit. It all seemed like a perfect storm. The vaccine uptake was sluggish, the positive cases were steadily high, with the death count beyond what had been previously recorded during the pandemic. This prompted the new government to announce the tightening of restrictions aimed at bringing the situation under control. Amid the constant barrage of bleak headlines, there was one emerging silver lining. By the middle of September, there was a steady stream of recoveries, sometimes higher than the number of positive cases. This meant the rate of increase was slowing down. Then came the release of Monday, 27 September, with the Ministry of Health and Wellness announcing a whopping 720 recoveries, taking off a significant slice from the number of active cases. According to health officials, St. Lucia is far from being out of the woods in the battle to contain COVID-19, with vaccine hesitancy and non-compliance to the protocols high. For now, they say the word of a turnaround seems premature, but the rate of recovery, though not yet a trend, is at least an encouraging sign. Lucia for the HCS News Force.